Senator Mutahi Kagwe, we really do appreciate the continuous collaboration that we've had with the private sector. When we look at service delivery provision in this country, I can say that the private sector is a strong and weighted champion with us, with the public facilities, and service provision is actually on par 50 to 50% between the public and private sector. And so this is just a recognition of the crucial role that the private sector plays in ensuring that Kenyans are healthy. And so to this effect, we've had a long relationship. Our relationship stems all the way back from the beginning of this fund being set up, NHIF. And we've been able to engage and ensure that Kenyans access services. We've been able to review the different benefit packages within this institution, NHIF, and expand service coverage for Kenyans. Today, we've had a deliberation, particularly that is nested on ensuring that service continuity continues, and more importantly, that as we work together as partners, we ensure that services are affordable for the Kenyan. And this is very, very important, particularly because His Excellency the President, Uhuru Kenyatta, has set a vision on ensuring that this country moves towards attainment of universal health coverage. And so in this regard, NHIF is a very key important player, ensuring that care and service delivery is affordable for you, the Kenyan. Part of our discussions today have touched on how do we ensure we have seamless, continuous engagement with the private sector. How do we have a review process that looks at the different prices and payments for different packages that we have on offer? But most importantly, the biggest point of discussion today is how do we ensure services continue undisrupted. And so to this end, I'm pleased to say, and the teams shall elaborate further, that we've reached an agreement. There shall be no halting of services at the private sector. We have given ourselves a moratorium period where we shall be able to review the current payment rates. We shall be able to come together around the table and discuss how we ensure care is affordable while ensuring the sustainability of both the private sector and ensuring that you as Mwananchi are also able to access services. And so really this is what we call a first step towards a journey. We should be able to come back to you on the decisions that we'll have agreed and the new payment rates at the appropriate time. But for now, it is to allay any fears that if you go to a private facility, you will not receive services. That fear should be completely allayed. There shall be no halting of services by the private sector, and we shall continue working together hand in hand, collaborating towards ensuring you are able to access services and that we're able to walk towards this journey of universal health coverage for the country. And so to give us further information on our deliberations today, particularly the time periods we've given ourselves, I'll invite the chair of NHIF to make some remarks on this end. And then, of course, we'll have a plenary session at the end of this.